What is going on, everybody? Askhole veteran back with another one of the PTSD videos, and I just couldn't resist. Because the one thing that anybody with an anxiety disorder or anybody who loves somebody with an anxiety disorder or any of that knows is the thing that probably affects us the most is sleep. Now, I have done almost everything I can think of to try and actually get a solid night's sleep. I've got weighted blankets, I sleep with the fan on, the window open, complex sounds playing on my uh, Amazon Alexa, and home security system. And I mean, the list is just endless. My home automation system is actually built from sleeping to beyond, and my bed is just built from the ground up to be like sleeping inside a giant pillow, from four comforters to a double pillow top mattress and everything else. And I still can't sleep more than 3 hours a night. And I'm like, what the hell? It's never gonna happen. It's just never gonna happen. Well, I got to talking to my friend Abby. This is Abby.
My name's Abby. I'm a patient coordinator at New Horizon Sleep Solutions, and we specialize in providing oral appliance therapy to patients who have obstructive sleep apnea.
And she told me about the new business that she was starting, and it was all about helping people sleep. And part of it was the whole not breathing when you sleep kind of thing, which of course struck my curiosity because what's the chemical ATP? Well, ATP levels in the brain actually affect kind of things like the intensity of your nightmares, the restlessness of the body, things like that. So I immediately got into a discussion and started asking her a million questions because I wanted to know more. It all started with, what you do sounds really confusing. What is it? So, of course, she responded with,
So, obstructive sleep apnea is a very common sleep disorder that occurs when a person stops breathing repeatedly during sleep. And oftentimes, this is because of an obstructive sleep apnea, where the tongue and the soft tissue and the upper airway here relax like all the other muscles in the body when we're sleeping and can sometimes fall back and collapse back and block that airway. So it's that obstruction that's causing us to not be able to get a full breath in, and that pause in the breathing can be very damaging to the body, the internal organs, and also to your sleep cycle. So it is important to address this if this condition is going on and get screened and tested.
and that kind of caught me off guard because I was like, what? Hold on, back up a second. What do you mean it's destructive? I mean, I've got enough destructive habits as it is, just having the anxiety disorder and all the stuff that goes with it. So what do you mean it's destructive? And she said,
So when you're in a cycle of sleep apnea, it continually brings you back up to those surface levels of sleep. So every time one of these apneas occurs, the brain is telling the body, I can't breathe, I'm not getting any oxygen. And so the body goes into a fight or flight response. There's that release of cortisol, that stress hormone, and it arouses the body enough to wake up a little bit, bring you back up to that surface level of sleep, just enough to be able to open up that airway and get a breath. So for a lot of people, what that looks like is there'll be a pause in the breathing or the snoring, and then all of a sudden someone will have kind of a gasp or a choke, a snort, kind of waking up, and that airway gets open, they get a breath, and then the cycle repeats again. So it's very important, to be able to treat this if this is going on so that you're able to get a restful sleep. You can get into those deeper stages of REM sleep and delta sleep, and get that nourishing, restorative sleep that we need.
and I was like, that explains a lot. That explains the cardiac stuff and the everything else. But what am I supposed to do to fix it? I mean, I've tried everything. And she was like,
So a lot of people are aware of CPAP therapy. It's kind of that mask that looks like the Darth Vader mask that you can wear at night with the machine that's giving you that positive air pressure. So it's that continuous air pressure that kind of creates a little cushion of air at the back of your throat to help maintain that open airway. So that's been around for quite a while and is still considered kind of the gold standard for treating sleep apnea by a lot of physicians. And if you kind of are more on the severe end of the spectrum with sleep apnea, they often will want you to start with CPAP therapy. And it can be really life-changing for a lot of people. You know, if all of a sudden you're going from not having a good night's sleep in years to being able to sleep restfully and restoratively throughout the night, there are people who love their CPAP machines and won't go a day without them. So that's kind of the traditional model. But our company specializes in oral appliance therapy, which is a little bit more unknown, but it's also been around for over 30 years and is a proven form of therapy for obstructive sleep apnea.
And I kind of got disappointed, and I was like, that sounds great and all, but I'm a vet with PTSD, so that kind of thing doesn't really apply to me so much. And she was like,
so one of the reasons why it's really important for veterans and the veteran community to understand sleep apnea is because veterans are at a 4 times higher risk of having obstructive sleep apnea than the general population. So a recent study of 195 vets who were being treated or evaluated for PTSD symptoms found that about 70% of them were at a high risk for having obstructive sleep apnea. And they found that that risk also increased with the severity of their PTSD symptoms. So if there are veterans who are experiencing PTSD, it would be in their best interest to be screened and possibly tested for sleep apnea if that's something that they might be at risk for.
and then I recalled from EMT training what CPAP was, and I started thinking, and I must have said something out loud. So I said to her, I said, I just kind of out of luck because I can't sleep with something attached to my face. And she kind of stopped me dead in my tracks and said,
so with oral appliance therapy, it's a simple dental device that's going to be fabricated just for you. So we take a specialized impression of your teeth and we're going to create the device just for your mouth. And all it's going to do is help to hold the lower jaw a little bit forward at night when you're sleeping to help prevent that soft tissue in the tongue from falling back and blocking that airway. So it's doing the exact same thing as the CPAP. They're considered a same or similar comparable treatment. They're just accomplishing that open airway in a little bit different way. So like I said before, the CPAP is giving you that continuous positive air pressure, which is helping to keep the airway open, whereas with the oral appliance, it's just that dental device that you would wear that helps to hold the lower jaw a little bit forward to keep that airway open. So one of the things I kind of tell people too is if you ever had a CPR class where they tell you to do the chin lift before you initiate CPR, it's kind of that same concept. By helping to just move that mandible a little bit forward, it's keeping that airway open and patent so you can get a restful night's sleep. You're not having the apneas and you're able to just sleep soundly. So a lot of people, like I said, like their CPAPs, but there are also a lot of people who struggle with them for various reasons, whether it's getting the mask to fit properly or, just discomfort from that blowing air or the sound of the machine, lots of different reasons. And for that reason, a lot of those people find success with the oral appliance because it's fairly comfortable to wear, it's quiet, and fairly non-intrusive. It's really just going to be that device in your mouth, that piece of the appliance in your mouth, but it's not really anything else. There's not going to be any kind of a mask with it or anything. And a lot of people, for that reason, find it easier to stick with wearing the oral appliance versus a CPAP at times.
So at that point, of course, it had my interest. And I was like, what do I do to get something like that? And she said,
so to fabricate the oral appliance, the doctor would see you in the office. He's going to do a full clinical exam to just check and make sure your teeth are, number one, healthy and stable to be able to wear an appliance like this at night. And then he'll take a specialized impression. So we have a digital impression scanner, which lets us take kind of an image of your teeth to be able to send to the lab, and the lab is going to fabricate that appliance. So a lot of them use CAD/CAM technology or milled appliances to do very specialized models of your teeth, and then they're able to create the appliance to fit for your model. So it'll fit nice and snug and nice and firmly on your teeth. There won't be any issues of it falling out or anything like that during sleep, and be able to just, again, help hold that lower jaw forward and keep you sleeping well.
And then that part of my brain switched on, like I was curious, and I was like, didn't I see those things at Walmart? And she went,
Sometimes those over-the-counter boil and bite type ones that you can find are not as effective because they, number one, are not customized by the dentist, so they're a little bit less accurate that way. And number two, they don't have any kind of a mechanism that allows you to advance the lower jaw forward. So it's really missing the boat there, because the real important thing that we're looking for with oral appliance is being able to hold that lower jaw forward. And so that advancement mechanism with the oral appliances is really the most important part there.
And of course, my immediate follow-up question was, I spent decades in the martial arts, so it sounds to me like you're kind of sleeping with a mouth guard, isn't it? And she goes,
so most people find them fairly comfortable. A lot of the appliances have a soft liner on the inside, so it's nice and comfy fitting over your teeth. And most people are able to adjust to wearing them within a few days or up to a week or two. We usually want you to just start getting used to wearing it for those first few weeks, and then after that point we would start advancing the appliance forward. So it's similar to like a sports mouth guard or an orthodontic retainer in the level of acrylic and the bulk in the mouth, but generally pretty non-invasive, and generally most people find it pretty easy to adjust to wearing.
And then I was like, okay, but how does it actually work? And she went,
so this is an example model of an oral appliance. This one is one that we often use for Medicare patients because it's one of the Medicare approved devices. And you'll notice here, this one's really easy to look at that advancement mechanism with it. And so with this guy, there's just a little simple wrench that you would use to turn the appliance forward. And usually we're only going about 1/4 millimeter at a time. So it's a really slow advancement because we don't want to put any undue stress on the TMJ joint or the jaw. So we're going to move forward nice and slowly, giving you time to adjust to it and everything. But this titration mechanism is really the most important part, because that's what's allowing us to find kind of that sweet spot, the Goldilocks spot, where it'll be, number one, the most effective at eliminating the apneas and hypopneas, but still nice and comfortable for you to wear. So we really are looking for an appliance that has that ability to advance the jaw forward. And the nice thing too is you can still open your mouth at night, get a drink of water if you need to, talk if you would need to. It's not like you're locked into anything. But yep, it gives us the ability to, very accurately adjust the appliance to find that sweet spot where it'll be the most effective for you.
So I was like, hold on a second. I hate the dentist. I mean, I literally went with a busted tooth for years because I hated the dentist. And all that being said, I have no idea what a dentist has to do with the ability to sleep at all. And she was like,
so another reason why dentists are kind of in a good position to identify people who are at risk for sleep apnea, and also on the same hand treat them with the oral appliance therapy, is because oftentimes a lot of the signs and symptoms of sleep apnea can also show up in the mouth. So one of the things we know is that if you're prone to grinding your teeth at night, bruxism, or clenching a lot, that can wear and tear on your teeth and be a symptom of sleep apnea, because oftentimes when we're trying to arouse the body to get that breath, the body will unintentionally clench the jaw to help reawaken those muscle tone to open up the airway there. And similarly, there's other things that the dentist can see in your mouth. Sometimes the uvula that hangs in the back of the throat, that little dangly piece of tissue, can look like it's flattened or elongated from that obstruction from the upper airway collapsing back on it there. And also things like if you're predisposed just from your anatomy. So sometimes people who have a very large tongue, or perhaps a lower jaw that's a little bit on the smaller side, some of those anatomical things can predispose you to being at risk for sleep apnea.
So I said, how do I even know if I've got this sleep apnea thingy so that I know if I need all this fancy stuff, or if it's just my mind that's messed up that doesn't allow me to sleep? And she said,
so some of the most common signs and symptoms of sleep apnea, the first one being loud and habitual snoring. So if you find that you're snoring on a regular basis, it's the kind of snoring that's disturbing your bed partner, your wife's always elbowing you to, get you to quit snoring, that's in and of itself definitely a risk factor right there. People who are prone to snoring are already getting a reduction in their airway, in their airflow, and so they're definitely at a higher risk for having sleep apnea. And along with that, people who have high blood pressure, type 2 diabetes, those are definitely populations that have a higher instance of sleep apnea in their populations there. And then also just those experiences of waking up kind of choking or gasping, or feeling like you're waking up frequently during the night. Those can also be signs. Or just if you're feeling really tired during the day, that excessive daytime sleepiness, all of those things kind of together can be kind of red flags or hints that you might be experiencing some airway collapse at night.
And then that weird moment hit me. And I was like, you know, I don't have a lot of money. I mean, I don't think I can afford all this medical testing and medical appliance and prosthesis and all these other things that go with it. And her response was,
so testing and treatment for obstructive sleep apnea is generally covered by most medical insurance plans. In order to get tested, we would recommend that you see your physician for an evaluation and just discuss your concerns with sleep, and then ask them to order you a sleep study. And for that sleep study, you can either go and do it overnight at the clinic, or they also have home sleep testing now, where you're able to take the kit home, you're able to sleep in your own bed, your own environment, and then return it the next day for them to make the diagnosis from that. Most medical insurance plans then also cover the treatment, which would be either that CPAP therapy or the oral appliance therapy. And with anything with insurance, I typically just recommend doing a prior authorization, but most medical insurance plans do cover this treatment. If you feel that you might be at risk for having sleep apnea, or someone that you love, encourage them to speak to their physician about getting tested and treated. This is a very serious medical condition and something that is kind of under the radar for a lot of people. So if it is something that you're concerned about, or want to just get a little bit more information about how you're sleeping and how well, definitely speak to your physician and get tested and treated.
so of course, me being me, I decided that I am going to go through all of it now that I know that insurance will pay for it and VA actually, will help get this done. And day after tomorrow, I'm actually headed down to get the stuff for the sleep study yet, which will be video 2 if they actually allow me to view or video like the instructions and picking it up. And I'll take the video of wearing it while I'm home. I just keep getting this picture of like this million wire cap attached to my head. But in the meantime, that's the first video. And that's where we're really going to get started. And I mean, it's really interesting, and I really hope it works. I mean, I really do, because sleep is probably the most underrated, under-experienced thing for anybody with post-traumatic stress. Now, I do have to give a shout out to Tom's Drawing Board. Tom at Tom's Drawing Board, absolutely great guy. I reached out to him and I went, hey, I got kids, I got neighbors, I got a service dog that likes to run through the house. I need a nice quiet place to put this together. Can I use your video? And he's like, yeah, sure, no problem. And I was like, great. And then I reached out to Abby and I was like, all those questions I asked you about all this stuff, can I ask you all over again so that I can do a messed up video and throw it up on YouTube for the world to see? And she was like, yeah, sure, no problem. So there's Abby, and I will put I'll put a link down to her business and Tom's business down in the description below. Now, Tom is a phenomenal artist and an even more amazing teacher. I will also link up his new YouTube channel so that you can take a look at that. And we'll get as much information as we can for Abby and what she's doing. And that way, if you have questions or things that haven't been answered by these videos, you don't just have to ask them in the comments below. You can reach out privately to her or somebody who does what she does in your local area and actually start down this path yourself. So that being said, I'm going to call it a night. I'm sure my son is probably asleep, and if he's not, he's tired of hearing my voice. And we'll pick it up again with the next video when we do the at-home sleep study stuff. So for that being that, hope you all have a good night. I hope good things happen for you. Computer, turn off bedroom light.
Okay.